Okay. So thank you for giving our students the opportunity to present his data on CAV3 variants in a large family with limb-girdle muscular dystrophy from Mali. Next slide.
Round in which I will have an overview.
So we will present some background and then the objectives, the methodology we used to find to find some results and discuss our results, and we will end up by giving the future work. And limb-girdle muscular dystrophy is a heterogeneous group of inherited muscle disorders characterized by progressive weakness and degeneration in the skeletal muscle. More than 30 subtypes have been identified today, and the prevalence of limb-girdle muscular dystrophy across all subtypes is generally understood to be between 0.8 to 6 per 100,000 inhabitants. So here we present CAV3, the gene role in not only muscle, not in the skeletal muscle, but also on the heart. So mutation in this gene can impact the function of this protein in the muscle level and in the heart muscle level, giving some cardiomyopathy, and also in the skeletal muscle. So the increase in the characterization in new subgroup in families with limb-girdle muscular dystrophy further adds to the heterogeneity of these diseases. These disorders have been described worldwide, but limb-girdle muscular dystrophy clinically and genotypically characterized cases are rare in Africa, sub-Saharan Africa. This is how we undertook this study with the objective of clinically characterizing families with limb-girdle muscular dystrophy features and identify the underlying genetic cause. So the study was approved by our local ethical committee. Written consent has been obtained. Participants before the enrollment, patients were carefully evaluated by a diverse team of neurologists and other specialists. EMG was performed, laboratory testing, especially CK levels were checked, and candidate gene testing and whole exome sequencing also was performed. So this is a large family. You can see with different two branches in which you can see affected patients. Although there is no reported consanguinity between parents, we can say that they are all from the same ethnic background and they live in close villages. You can see that the two married sisters have affected, but interestingly, all the affected are females. So this can be by chance or also to have some underlying explanation. So the family with 6 affected females in 2 branches, there was no reported consanguinity, as I said. The age of onset was 3 to 6 years with walking difficulty. They presented with proximal weakness, making raising from a chair difficult and also climbing stairs difficult. The disease progressed in boots with a slow progression. So in clinical examination, there was proximal weakness in upper and lower limb. Reflexes were reduced to abolish they had a waddling gait, and Gower's and the Fuller sign were positive. So the older patient presented slight skeletal deformities like scoliosis and pes caries. So here you can see the X-ray for one of the oldest patient who was ambulatory at 30 years old. So meaning that although started early, but the progression is very slow. CK level remained normal, but raised to the upper normal in the oldest patient, and the EMG cardiopathic pattern, there was no cardiac involvement. So then did the candidate gene testing, including calpain-3, dysferlin, sarcoglycan, and SMN, because we were thinking of recessive limb-girdle muscular dystrophy, but they were all negative. However, whole exome sequencing, I think, showed a homozygous variant in one of the family, and the two compound heterozygote in the other branch of the family. So, but one of the compound heterozygote was present in the other family as a homozygous pattern. CAV3 was associated with dominant limb-girdle muscular dystrophy, but some rare cases of recessive pattern was shown. So the recessive variant was located at the C166, a G to A change, leading to a glycine to serine change at position 56. So it was reported in other families with dominant and recessive panel. However, the compound heterozygote panel wasn't previously reported. This variant matched the disease status in all genotyped individuals. So here we discuss the homozygote variant distribution. You can see that we have found in the two branches that the left branch, the father has one mutation, and the mother also has heterozygote variant, and the mother had another heterozygote variant. Left panel, the homozygote for the mutation, and the other system on the left has one heterozygote variant, and the other one has one of the other the other variant seen in the left branch, but transmitted in her only one of the variants, the other having come probably from the father, but the father wasn't available to be to confirm really what we suspect compound. So our future work is continuing with the segregation, because not all the family in the pedigree were genotypes, and to do also some in silico prediction, maybe some functional studies for the novel compound heterozygote variants. So limb-girdle dystrophy is a large group of muscular disease resulting from the abnormal production of different proteins. So we found a novel and muscular dystrophy. Our findings supports the pathogenicity of and adds the already known genotype phenotype variant the cabelloneuropathies. So you would like to end by thanking the study participants, especially the neuro